We will now call this meeting to order. I'll first read the agenda. I apologize for the delay in starting the meeting. But now I will read the agenda. Tuesday, November 14th, 2023. The New Haven Board of Alders Health and Human Services Committee will meet in person on Tuesday, November 14th, 2023 at 6 p.m. in the Board of Alders Chambers, 165 Church Street, second floor, New Haven, Connecticut, to deliberate LM-2022-0512, order calling for a workshop on annual homelessness strategies and initiatives and departmental updates on the effectiveness of existing programs and initiatives made to solve this important social problem. This item is on file and available for public inspection in the Office of Legislative Services, 165 Church Street, New Haven. For order, Honorable Alex Guzne, the Chair, attest Honorable Michael Smart, City Town Clerk. If you need an accessibility related accommodation, please contact 203-946-7651 voice or 203-946-8582 TTY. In accordance with the City of New York COVID-19 policies, unless I'm optional, public may send comments to public testimony at newhavenct.gov. Having finished reading the agenda, I'll now quickly ask my colleagues to introduce themselves.
Good evening, Mr. Chair. Richard Furlow, Ward 27.
Alder Eli Saban, Board 7.
Alder Alex Guzman, Ward 1, Chair of the Committee.
Good evening. Amy Marks, Ward 26.
And I'd just like to also recognize that we have Alder Carmen Rodriguez from Ward 6 joining us. Thank you for being here tonight. So just really quickly before we go in to sort of what we have tonight, again, just want to quickly just reiterate and reemphasize the issue of homelessness, of helping our unhoused population here in New Haven is an issue all of us here in this room take really deeply. Others and colleagues that have joined me also on board, but not on this committee also take this issue just that seriously. And so we kind of hope the goal of this workshop is to hear more about the city, what sort of strategies and initiatives they're taking alongside the partners who are in the chambers tonight, and then also ask questions from us colleagues about ways the city and its partners and various organizations can improve on their work. So having said that, yeah, just kind of want to have that out there. It's a sensitive topic, so kind of ask folks, especially during public testimony, to really pay attention to that, the sensitivity of this. We will now begin. First is the city staff coming up to present, give a presentation. And for anyone who comes up to the table, we just quickly ask that you state your name and address for the record. And I'd like to recognize an Alder from Ward 14 just joined us, Alder Miller. Thank you for joining us. Whenever you're ready, just please state your name and address for the record.
Good evening, Elders. Pleasure to be here. My name is Carlos Sosa Lombardo from Cooper Place, New Haven, Connecticut.
Bella George, Milrock.
Can you proceed?
Elders, thank you so much for the opportunity to be here to perform this workshop. We'll just really quick run over the roadmap. We're going to talk today about some background statistics. We're going to provide an overview of the response system for unhoused residents in Haven. We're going to talk about homelessness services. And, we're going to talk about some challenges in the context that we presented last year and some progress in some of those issues. And we're going to be highlighting growing partners as well. pretty clear that we have an affordable housing crisis. Across the nation, millions of people struggle to find housing, affordable housing, that is. There's a shortage of an estimated 7.3 million rental homes affordable and available to renters with the lowest income, which is below 30K man. There's a shortage of 89,000 units for extremely low income renters. The rented units in Henry County, meanwhile, have increased up to 26% from pre-pandemic 2020 to September 2023. And the new Haven uniform vacancy rate is 1.4% compared to 2.1% statewide and 5.6% national average. We also know that there's a lot of housing instability. Around 54% of the city's households are rent burdened. The housing cost burden is more pronounced in Black and Hispanic households, and the eviction rates meanwhile are higher than pre-pandemic levels. According to research, cities that have higher housing cost burden and low rental vacancy rate have a higher number of people who are unhoused. And we're gonna dig now into how what we're doing is how the response system works, dig into some um, more concrete stuff. And I'll pass it on to Lola.
Thanks, Carlos. All right, so with our homeless response system, it begins with our Greater New Haven Coordinated Access Network, which serves as a doorway to services. These services include shelters, warming center, housing. Also, we have navigation hubs, outreach and engagement services. We also included in that we have medical and psychiatric street medicine, and our newest addition to this continuum is in the city campus. So what do we do? At the City of New Haven Office of Housing and Homelessness, we work in collaboration with our homeless partners and state agencies to provide access to housing, resources to individuals, families, and youth who are experiencing housing insecurity and at risk of coming unhoused. Our portfolio consists of warming and overflow centers, navigation hubs, homeless outreach services. We also have a one-stop pop-up shower. We offer prevention and depression services, case management, rental assistance, and our newest addition was added temporary bed shelter at 209 Terminal. Just to highlight a few of our achievements this past fiscal year, the fiscal year 23. As far as warming and overflow centers, we had over 1,400 calls for service. We also served 366 families in between hotels and shelters. Our rental assistance program and diversion program were able to serve on 94 households. We offer case management across the different programs, over 800 case management services. And the mobile shower this past year was over 1,200 calls for services. And the navigation hub itself was over 1,400 calls for service. As we look back at our navigation hub services from 2022 to 2023, we saw a 27% increase in calls for service at our navigation hubs. Our navigation hubs serve unhoused individuals. And basically at the navigation hubs, they work to provide basic necessities for our individuals that are unhoused, as well as connecting them to services. The navigation hubs are diverse. There's some that offer basic police. And there are others that have a medical component to them. There are others that have employment components to them. And they all serve, provide some form of case management for folks that are interested. But most importantly, these navigation hubs serve as a place of respite for folks during the day and evening hours to get out of the elements, whether it's summer or winter. It's a year-round program. And also part of our navigation hub service, we incorporated our mobile service, which we call our one-stop pop-up. That includes the power in the shower, and we also partner with the Medical Van and Cornell Scott um, Street Medicine Team and Liberty Community Services. With, in 2022, we had, when we first started this initiative, we saw 347 calls for service. This past 2023 fiscal year, it was over 1,200 calls for service. I also mentioned that part of our portfolio includes prevention services. In addition to providing rental assistance, which includes security deposit or rental repairs, we also provide utility assistance. And so this past year, we were able to assist 125 households with rental assistance and 167 households with utility assistance. I mentioned earlier about our seasonal capacity. In 2020, fiscal year 2023, we were able to stand up 4 warming centers, which we did in partnership with the United Way and the Department of Housing. And last fiscal year, we were able to provide 146 spaces for adults that were unhoused. And we also had our one overflow site at Columbus House, which provided 40 beds. Um, with our warming centers that we had last year, we were really privileged to be able to extend our seasonal warming center from just December to April. Instead, we were able to do it through the spring and the summer. And that's in, again, through our partnership with DOH and the United Way. We were able to basically offer warming services year round this last year. This fiscal year, we're looking at standing up 3 warming centers. One at Barrick, which is on Dixwell Avenue, 180 Center on East Street, and upon this Rock Ministry. The one change, these are the same 3 agencies that did warming centers last year. The difference with this one is upon this Rock, which provided services on Grand Avenue in the basement of the church. Well, this year, because of the new fire regulations, they are going to have to move their warming center. We were able to secure space at 130 Orchard Street at the old Morrow School to be able to provide space for the on this Rock Ministries warming center. And as a result, we're also able to increase the capacity at that site too. Whereas their current site, it's up to like about 30, 35. With this site, we'd be able to go to almost 50 people. So that's a plus. So as we look forward to this winter's capacity, we're able to add not only the warming centers, but we also have shelters for singles, which Columbus House offers. And the new thing that we're adding this year is, and we're proud of, is our family triage space. And their family triage is a space that families that are home, a lot of times shelter beds are not available. And families need a place to go in the short term. And so the triage space would serve as a place to get families off the street while we get into a more suitable space. And this year, the overflow space will be we transition into terminally serving individuals, going to be serving families once we transition them from the terminal to the Moros 30, 130 Orchard Street. Um, that's it.
Yes, and I just want to add in that section that between the increased capacity at the overflow centers and the hotel conversion into emergency housing, we're looking to add an additional 106 spaces and beds. So we be able to help 106 more people be sheltered from the elements this winter. In terms of challenges, one of the issues was raised last year was the reduced amount of shelter beds compared to pre-COVID levels in demand, in current demand. So our progress to tackle that issue is we purchased a hotel, a homeless shelter for up to 100 unhoused people. At the same time, we secure a $400 grant from the Department of Housing. Second issue that came up was the lack of housing stock, including permanent supported housing and deeply affordable housing. So far, the city has secured a $4.8 billion home ARP from HUD to use as leverage for capital projects to increase deeply affordable housing stock. As you all may remember, the World Holder approved the plan early that last year and had internal approval. We also have ongoing strategic planning to leverage local, regional, and state resources. And the third issue was challenges with accessing mental health and substance abuse services. For purpose so far, we have partnered with Continuum Care to build REST Center, which is a crisis stabilization center to provide rapid access to crisis care. And we also saw in City Campus, Continuum of Care, they secured an additional grant for case management services tailored to frequent service users, which include people who are homeless who may be using the public services. And what's coming next? We are trying to launch the 270,000 emergency housing project. We're hoping that coming this winter, we can have a regular calendar. We're working on completing our strategic plan, relationships with the region. We are coming into the winter season in Belma, and we'll be focusing a lot, making sure that people are and have access to shelters and alternatives to housing. We are looking at doing some data collection overhaul and identify projects for home ERP funding. That being said, I want to close all of these sections of the city and invite all partners to come and talk, to present the great work they're doing and talk a little bit about the challenges that they're facing. The first one I want to call.
Sorry, if somebody interrupt, I think it'd be good to maybe just, we ask colleagues if they have any questions before. So, maybe questions. Very good.
Thank you for your presentation. It's good to see you this evening. What I don't see on the list are the hotels in Amity. Are they not going to be online this winter?
Hotels in Amity.
When there?
So during COVID, we did use the hotel in Amity, but we haven't used that in the last 2 years. We've been And that was paid through COVID funds. So once those funds dried up from hotels, that's why we increased the number of walk-in centers that we had last year to accommodate those beds.
So we're not going to be any hotels for this winter.
Not through my program.
That's all I have. Thank you. Thank you, Mr. Chair.
Thank you, Majority Leader. Any other comments? Alderman.
Thank you for the presentation. I wonder if you could talk about how you track outcomes for these various initiatives, like how many people we move from homelessness into housing as a result of these programs. Other outcomes too,
Yeah.
but that's
So one of the things, Carlos and I talked a little bit about it. We do track outcomes across our programs, and one of the key things that we've seen is a marked drop in the ability to work with the house this past fiscal year as opposed to previous fiscal years. And Carlos mentioned about the barriers that we face when it comes to being able to house families, from housing stock to folks with, as far as income. One of the key things we're seeing is landlords that are requested 3 times the income be 3 times the income of the rent. So those are two major barriers that we see that's making it even difficult for us to be able to house people. But most of all, it's the low housing stock that we're seeing. And so a lot of our families too are seeking housing in Valley and Waterbury because they're cheaper.
so you don't have a number for how many people moved into housing.
We don't have a number of you, but we can provide it to you. We do have 2 reports. We require all contractors to submit quarterly reports with metrics. This is one of the metrics that we require. We're more happy to provide that to the chair.
My other question is just a little kind of a bigger one, which is, do you think it's possible for us to get everybody that is on the street unhoused into either shelter or housing? And do we have a plan for what that looks like? It
So,
seems like I see the strategies, but I don't see like, we're here now and this is how we plan to get to a place where we don't.
but I can talk a little bit more about the strategies that we are having now, especially in the context of the hotel and making sure that people are willing to go into. Now, in addition to that, we all know there are people who come from the streets. We all know that there's 2 subgroups of people that come from the street. One subgroup, they need a place to stay, they don't have it, and oftentimes they're willing to receive services. And that service may be going to a warming center, into a shelter, or be matched to housing, for some type of housing, to our workers. Now you have also a population that choose to live like that, and are refusing any of that services. With that population, what we're doing, what we do, and we could keep on doing is engage in building relationships, making sure that we have some type of connection with them, either on a weekly basis, and when things are very busy, we also provide that intensive service, doing outreach consistently. However, we can force everybody to go into a shelter or go into housing, and I think that it's going to be important to have a conversation, a real conversation. Really, what do we do with people who don't want any type of access and choose to come in our place? And yeah, answer your question.
Yeah, that's very helpful. Just one quick follow-up. So for those people, do you feel like there's nothing we can do, or that maybe we don't have the services to meet the needs of that particular group?
For the ones who do not want receive services, we have services, and I would say about 95% of the people on the streets are connected to services. The ones who do not want to receive services, there's nothing we can do about it. Of course, unless they are in a situation where they don't know who they are, they don't know where they are. Those situations, they can be committed to the hospital and be provided with supports in the hospital. oftentimes people, they're very well aware and they're not in the house, will treat it like something.
I just wanted to add too, I think as an office, we've evolved quite a bit over the years. This past year, we've been able to stand up quite a bit of options for people. Several years ago, we just had shelters. We since have, centers, we've been expanded number of apartment centers that we provide to be able to accommodate the numbers that we're seeing. In addition, we recognized that we needed to add a low barrier aspect to our services, which we were able to do, and which we will be doing also through our warming centers, and also even the hotel, where we're looking to be able to offer options to people, because we recognize that there are special needs out here. And so, in addition, so we're looking at, we have shelters, we have food centers, we have the hotel that we're going to be standing up this winter. And also, Carlos mentioned about the home ARP funds. What we're looking to do is to be able to leverage those funds to be able to create permanent housing options for people. So we want to be able to create a continuum of services.
Thanks for the additional information. Just one quick thought, Mr. Chair, which is the home ARP, if I'm remembering correctly, part of it was for non-congregate shelter and part of it was for housing, right? So the project selection is for both, or for just one, for both? Okay.
Thank you, Alder Singh.
Thank you, Mr. Chair. Sort of a follow-up question to my colleagues' questions. I was wondering, as you mentioned that there are some folks who are refusing services or don't want to go into housing. I've definitely heard that, we may hear later, it's discussed that there are issues, I think, cities where that people don't want to go to the shelters for particular reasons, maybe to leave very early in the morning, come back at a certain time with not enough storage space, bring partner or pets or things like that. And I guess this may be a question I'll ask with service providers later, but I'm wondering if we're doing, if any of those policies that we know of as barriers why people don't want to go into shelters, those things that we're working to change. How are there reasons that we can't change that? Maybe there's funding that's tied to us having rules. If you could just talk a little bit about it.
Yeah. So to answer your question, yes, we are looking to address that, and that's one of the steps. Step one was the low barrier warming centers. That was the intro. Our next step now is our hotel that we're looking to stand up. With the hotel, we're looking to be able to address those issues where we'll be able to offer space to couples. Well, it will be space where they don't have to leave out and try to get back to get a bed, but it will be a space that they will have, where they'll have access to in-house case management and different services. And there is also, we're also working to be able to have a few spaces where people can have pets. That's a piece that we're working through. It's more involved than the city letting people come in with pets. So we're working through that piece, but that's one of our goals, to be able to offer that option too.
And at the same time, we're also exploring more long-term urban solutions and alternative housing options such as tiny houses, SROs, other practices that are being conducted in our jurisdictions to address this specific issue of people outside.
Thank you, Mr. Chairman. Ask one other question. So specifically about the time issue of when you have to leave or come back, is that something that the city is working on, or if you could just talk a little bit about?
With the new program that we're doing, they won't have to leave every morning and come back.
Right, but I mean, I understand the reasons for the Fox and Boulevard project are to address what I'm trying to, raising. The other beds that we have available for warming centers, et cetera, is there working on trying to make, I guess, as many of our beds that we have as possible more flexible maybe so that more people would want to take advantage of the service. Yes.
And the biggest barrier is a financial barrier elder, running 24/7 services at these other shelters, mean double funding basically. And this fund comes from DOH, and DOH is not willing to fund more than they don't have the funds. So that's the direction we want to work towards. I mean, we do need to have the financial capacity.
Thank you. So it's helpful to understand the reasons for that. Obviously, I think it makes sense for us to be prioritizing our funding for the overnight hours. Let's call it that. I appreciate that we're working on addressing those barriers. Thank you, Mr. Chairman.
You understand, any other questions, colleagues? I just have one last quick question, sort of on a similar vein as my colleague. I'm just kind of curious as to like whether the city knows like how distributed like low barrier like farming centers, shelters versus maybe like a little bit more high barrier or things to get into, like 60%, 40%, like low barrier, high barrier, or I don't know. That's a good question, or if I framed it right. Um, but just to get sort of an idea of what's low barrier percentage of services that are low barrier versus things that are.
Specifically shelter services or?
Well, I think shelter, warming centers, I think all that.
Yeah. So in terms of shelter, environment centers, and jumping here, encouraging, we do receive DOH or programs funding for services. And part of the requirement is to provide low barrier services. So it's tied directly into contracts. In low barrier, doesn't mean there's no rules in place. It means that, you know, if people are a little bit intoxicated, if we need to the program, they're intoxicated, they won't be refused services unless they post a complaint to themselves. No, impact something.
And just as far as percentage, all of our warming centers are low barrier. And the new hotel that we're standing up will be low barrier also. That answers your question.
Yeah, I think, yeah, no, I mean, yeah, I think it answers a bit of it. I mean, I think I just would be good to see what maybe other shelters or warming centers are considered. I mean, warming centers, sorry. I know you just mentioned their local hall, local barrier. But as for shelters, I think there's some shelters that are a little bit more.
So, just to add to what Carlos was saying, with DOH, that's one of the new rules that they're bringing in place. So there are some shelters that may not have been specifically low barrier, but with the ones that DOH are funding this new cycle of funding, that's one of the requirements. So that's changing. So, you know, and I know the DOH did do the applications and they're going to be making the announcement of who gets what. So, you know, we can't really speak to, like, for example, Columbus House. We do not fund Columbus House. So, you know, there's no, you know, severe funding comes strictly from DOH and DEMIS. And so they would be working as far as the rules for those different agencies.
Others, like, if you like, I can also reach out to DOH and ask them this very question about how many of our shelters are lower in the city. If there are any ones that are not, and I'll forward it to you.
Yeah, no, I think that would be super helpful. Again, just to set maybe next year, the next year's workshop, be able to see maybe if there's trends into more low area shelters or warming centers. Yeah, I think that. Yeah, thank you. Thank you. You can continue.
Thank you, Alec. I appreciate it. I want to call our first partner from Christian Community Action, Reverend Bonita Grubbs.
I'm not going to do that.
Good evening.
Good evening. So I decided that I would do this, share this information with you in two parts. One is to talk about the work of Christian Community Action, but also to create an opportunity for BoA to share our coalition.
Before you continue, can you just quickly just state your name and address for the record?
Oh, shucks, Anita Rhodes, Christian Community Action.
Thank you so much.
So Christian Community Action has been serving families since 1967, so we've been around for a few years. Now, it offers short-term apartments for housing to families at its 168 Davenport Avenue location, 166 Davenport Avenue location, and 124 Sylvan Avenue. Today, up to 17 families access emergency housing in individual apartments. Between October 2022 and 2023, 22% of the adults increased their income. All families received support from family coaches, formerly called case managers, because we wanted to emphasize the fact that it's a system process. It's not just waiting for you, but we with you. So the emphasis is really on how we can work with the families and staff can work with families to make that difference. All families receive supportive services for up to 1 year after moving to permanent housing. Knowing that families were born a temporary place to stay and live before it was a commonplace, CCA implemented a generational approach to serve families. Parents and children to promote family stability and economic security. Goal was and continues to be to promote and implement a solution-based approach and a pathway to stability for families and skill building for the head. CCA has had a proven record of offering family-focused opportunities and pathway in areas such as employment and child and family services through our accessing resources for independent skill building and employment, otherwise known as RISE. CCA is a faith-based organization, so RISE is part of what it is that we want to offer. It was established in 2015. After our stepping stone program on Winchester Avenue was shuttered, we actually were able to reopen our former transitional housing program as another acronym, New Hope, higher opportunity, purpose, and expectations. Because what we really want to do is not just to allow for individual families to be housed, but also to get an opportunity to improve and to increase the skills that they can have and the support that they need. We don't call the individuals who are on staff at CCA case managers, we call them family coaches because it's a participatory process. We can't do more than what the family head household will allow them to do. The new public boards heads of household the opportunity to increase their income, employability, improve the quality of life. Overall, it's designed to improve family stability. It is a results-based approach that addresses problems of families in need, either to prevent a serious or return to homelessness by offering multiple levels of resources, educational programming within that area of service provision. Developing community partnerships, because we can't do it all, and we need partners to be able to make the kind of progress. And focusing on implementing educational programs on employment and self-care. In short, BoA offers new promise and possibilities. It's a compassionate, comprehensive, and coordinated approach to serving families that are homeless or at risk of homelessness and heads of household a better life for themselves and their children. It's designed to address and hopefully solve the problem of homelessness, one family at a time. I think the only other thing that I would mention, I'll turn it over to the that really what we want to be able to do is to create a path of compassionate, a place of homelessness, and to really work with the heads of household to allow for their kind of progress. So whether it's, employment or child and family services or other support services, it's really saying you are starting at a certain place, but beyond that, there's more to come. And so how can family heads of household and the children within these families to get to a better station in life and higher stability. But let's start now. You'll notice by the t-shirt, Claudette has on, it's called Room for All, and it's a part of our grassroots organizing and grassroots efforts. So I'm going to turn it over to her so that she can share what it is that she does and what good trouble she makes.
Good evening, everyone. My name is Claudette Kidd. I'm here today invited by to talk about my experiences of when I was homeless. So this happened back in 2017 due to circumstances out of my control. I'm an educated person who has worked all my life until I had an accident at work. And on coming back to the USA, staying with family, things didn't go too smoothly. I ended up in the streets just before Thanksgiving. That was like around about this time, actually. And before going into a shelter, I was on one of those hostel places on the street on Wade Avenue, those hotel places, which is disgusting, by the way. And when you don't have a choice of anywhere to stay, anywhere you can lay your head is suitable. So eventually I got housed at a shelter in Fairhaven. I was there for 7 months. And so people come and go, a lot of regulations. As Carlos and Velma was saying earlier, there's restrictions as to like time, even in those shelters. You had to be in by a certain time of the evening. So for instance, when I used to come and testify here, I had to get permission like weeks ahead of time in order to stay out past curfew so that I could be here to testify about homelessness. So my stay there wasn't too great. I had to advocate to get myself out of there to get housed because the system isn't too fair as to who gets housed and where. One day, Meryl Egan came to the shelter and started talking about Christmas New York. And since that day, I've been involved with Christmas and more so Mothers and Others for Justice. And Meryl has helped me to go about advocating and advocacy and doing things for myself instead of waiting for things to happen. So she got other grassroots organizations, she got she got Gary Winfield, she got Corin was involved, and between us together and coming down this shelter, a lot of things, well, they're doing a lot of things right, and they were doing a lot of things that was not right. So the Senator Looney and some of the other people decided to come down to the shelter a visit. So rather than have them come and visit, they gave me such a real. So that's how they got rid of me. But that wasn't the end of it because from then onwards, I decided to have a voice for those who didn't have a voice or who didn't know how to speak up for themselves and needed the help and the resources and everything. So I became with the systems through Mothers and Others for Justice and going to the state capitol and testifying when legislation was up and testifying here on a regular basis. I was part of the homelessness committee with Velma and PI. And since then, I'm now a housing commissioner doing work from that level. Also, I did become housed by the way, housing and quite content with it. Also, recently, we've been trying to get reach the community a lot more. So we've been doing a lot of different events. So last Saturday we put on a forum on housing and community power. And with that, it involves New Haven System, Connecticut Tenants Union, Room for All, and Mothers for Justice. And we had guest speakers on tenant unions, knowing your rights, housing advocacy, and state services. And the services that I was presenting this evening, I want to meet up with you guys so that like we can put that out there as well. The event was a big success. Turnout was low, but the quality of people that we had there was great. The presenters that we had there was great. There was some powerful information, different workshops. We're planning a part two, so we'll be sending information out on that, and it will be on the University Community Action website. Also, we're deciding to go on the media platform where we got funded to do a podcast, and it's all around housing and homelessness. So we're trying to get the information out there. We're trying to build collaborations with other organizations because we can't do it alone. We feel that with other organizations involved, we're more powerful in numbers, and that's what we want to do. To make changes, we need numbers, we need data, we need people with representation. So that's my story.
Thank you.
And so I just want to say one other thing. We don't want to do it for people. We want to do things with people.
Them.
Because people have to participate in the improvement of their own circumstances. And that's why, that's why we changed the name of the staff from case management to family coach. So we wanted to emphasize that it's a with and not a for.
And just to remember that having a home is a human right. And there's so many people out there without a home. And not only that, like once you are housed, that's just one stepping stone. The other stepping stone is now letting all of that out and dealing with the mental aspect of it. So you're housed, but now you need like behavioral health services. And you need counseling to help you deal with all that trauma that you've gone through, PTSD and everything, which sometimes isn't recognized as much, but needs to be focused on a lot more. In order to maintain housing, you need extra support, and with counseling and other resources.
Reverend Rose and Paulette for both coming here and talking about what your organization does, and especially you, Paulette, for sharing your story with us. I think it's, at least for me, and I speak for my colleagues, I think in this case, it's always looking back on this sort of here, albeit difficult, the stories that here in New Haven to find housing. And so we really appreciate you coming here to testify. So if any colleagues have any questions? Alderman.
I'll just thank you very much for all your work through many years and your advocacy. Just one question, which is there anything particular, could be on any front, structure, policy, program that you think the city of New Haven could do to get more people into shelter and or housing?
Well, I think for me, it's creating a pathway, however that is, because we don't have something that is the next step, or this is not a next step, whether it's an organization that provides permanent housing or connection with the housing authority. Our New Hope program, as an example, is open as a partnership with the housing authority. But what we know is the path to being housed is a job, and it is an opportunity for individuals to be able to work with a family coach, work with an employment specialist, work with a child and family specialist. Those are supportive opportunities for families because they don't know what they don't know. Number one. And number two, it is that a lot of past experiences are comfortable even though they think. And so creating that new opportunity, that an avenue through which there can be that support practice, that they know that there's a trusted person who can help, to support and maybe even challenge the individual.
Thank you. And do you feel like we have those pathways in place, but they're not being used, or we need more of them?
Everyone needs more of them. Yeah, because the inner ring of emergency housing, emergency housing support, but there needs to be a couple of other having to do with employment and job services, that makes the difference and creates a pathway out of housing.
Thank you so much, Alderman Miller. Any other questions from colleagues? Seeing none, again, really appreciate you all coming out tonight.
Thank you for the opportunity to share.
Reverend Grabson, thank you so much. It's good that you are part of the story.
You're welcome.
I would like to call next Kelly Fisher from the Greater Haven, Way of Greater Haven.
Kelly Fitzgerald, United Greater Haven, located at 370 James Street, New Haven. I wanted just to thank Velma and Carlos for inviting me today to represent United Way, but also as the backbone to a coordinated access support. And that is the system in which people are able to access both emergency services as well as I have it on my phone, but paper works as well. And I presented last time, and so I'm happy to kind of do like a really high level overview for anyone who wasn't a part of that conversation, but really focus more on what has changed, we've been doing differently. And so again, one thing I want to start with though is what is the CAN not? The CAN is not 211. And wanting to reference that because a lot of times when we start having conversations with people about what's working and what's not working, we hear I sat on the phone for an hour waiting for a CAN appointment. And just referencing that is absolutely their experience with 211. We do a lot of work to help advocate for more funding to 211 because there's like anything else, there's just not enough people answering the phone as those that are calling in. But also working with them to help figure out what are other pathways into the CAN system besides 211. And so I really just wanted to start clear the air on that one because it always comes up at some point. So again, the history behind coordinated access, the federal government required states to start working together. Historically, agencies work by themselves. If someone was experiencing a housing crisis, they would have to call every individual program to see who had an opening, who had resources to help them, and it just wasn't the most efficient. And so the federal government required that states do that work, and so Connecticut then implemented CANs. So that's the term that you'll hear over and over. And again, really the goal of that is to have a centralized process that is clear and transparent for how people can access services. In terms of how that falls within the state, there are 7 CANs, like anything else, an arbitrary line where then we say, you all start working together. And so there is a slide that lists the towns, as well as a slide of providers. Another thing I want to reinforce is that the CAN is not any one agency. United Way does not make decisions in our office and then say everybody else has to follow this. It is a group of providers and funders and municipalities who come together to say, how can we leverage everything that we have to try and meet the needs that's in our community? And so one of the benefits of that is the resources that we're able to leverage. So I do have a slide in here to give you a sense of, because we're regional, on behalf of New Haven and others, we're able to leverage multiple resources from different services. We have 9 entry staff that are dedicated, some specific to Shoreline Valley and Greater New Haven. We have over 200,000 at any given point of diversion funds. We're waiting on some new funds from Department of Housing to get back up to that. All right, so we're able to leverage these dollars from different communities to be able to meet the need. We talk a lot about shelter. There's 348 shelter beds in our region, and that does not include the new shelter that's coming online. In addition, and Belmo talked a lot about the cold weather, we are able to bring in a little over $1 million of cold weather services that will be funding almost 100% of the warming centers, both within the city of New Haven as well as in Hampton. So that, again, is just trying to give you a sense of what we're able to bring in addition to the funds that the city of New Haven puts in, we're able to leverage all those other resources. So next, I just want to kind of talk a little bit about the client flow. Really, what are some of the updates to that? As I mentioned, we have had a goal over the last few years to increase access points for CAN appointments. So the historical, you have to sit by a phone, call 211, wait for a CAN appointment for days. We really just said many years ago, like, that's not working, that's not enough to meet the needs of the population. And so being able to partner with the hubs that Thelma mentioned, we have staff at hubs that can be there for in-person appointments, scheduled or just walk-in, as well as you can now just call our hub number, whether you call 211 or not, to either get a new appointment or try to connect to the person that you've spoken to before. In addition, another option is that we've worked with our outreach teams to have a direct link. So those who are sleeping outside and connected to outreach, all that outreach worker needs to do now is call up our team and say, I'm working with someone, they want shelter, or I'm working with somebody, they're outside, we need them on the housing list. And so trying to remove as much of the bureaucracy as possible and the administrative steps to make it as easy as possible for people. And while there's still, I think, a ton more work to do that, as I've heard you guys having some conversation around low barrier and how do we meet everyone's needs, that's one of the things that we continue to look at. Last winter, we actually did a series of focus groups at all of the centers to ask that, like, what's working, what's not working, why are you choosing this resource over somebody else, so that we can take that information, share it back with the programs, so that they can think, how can I incorporate some of these changes to make it more accessible for people. Some of the other changes, again, as I mentioned about diversion funds, we're really working to increase resources. There are many people that come to our front door that really just need access to one-time funds. Those could be security deposit, first month rent. It could be transportation back to family or friends live. We want to make sure that funds are available for those. As well as, Belma mentioned this before, maintaining overflow capacity beyond cold weather in order to help keep people inside after the cold weather months. So again, all of these pieces, our goal is to make the process efficient, equitable, and transparent. Actually, hearing Claudette's story makes me think about the really early days of CAN when we were trying to figure it out. And even though I wasn't here, hearing stories around that, and I just, we're a system that continues to evolve and has evolved so much that if anybody has a question of why I didn't get housed, why I didn't get that voucher, we have a really clear process to be able to share with them where we are. And unfortunately, I think one of the biggest messages is the problem is there just aren't enough resources, right? So right now we have over 700 people on our binding list. So people who are literally homeless waiting for us, right? Our shelter wait list. We have over 150 people on our shelter wait list waiting for help. And that doesn't even account for the population that we talked about that needs something. And right now, they're not even putting themselves on that list because they don't want to go to one of the existing programs. But just to kind of give you a sense of the scale versus what we're able to provide and just those challenging, tough decisions. And so a lot of my work is doing advocacy to try to adopt that message and bring to people this information so that we can bring more resources to meet the need. Really, many of us feel that this is a system that works. We just don't have enough scale to meet the need. Then I shared just a few other charts to give you a sense of, again, like what we're seeing. From the front door side, we are seeing a slight decrease in the number of people trying to access CAN appointments, so kind of starting to go back to pre-pandemic. One thing I'll say is that our diversion rates, even with access to funds, are lower. So the people that we're seeing are much higher need, and we're unable to divert them from our system. We are seeing right now a significant increase in families who are seeking emergency shelter services. And then again, I already mentioned the binding list. So really just again, as a system, our focus is to be person-centered, really try to work with providers to look at their policies and procedures, figure out how we can make sure that we're meeting population. And again, building strong partnerships with other municipalities. One example I'm going to share, the town of Camden has recently allocated ARPA funds to the Camden to help address homelessness. Guilford has really been a great partner in accessing state and federal funds to support our work. We really need that to grow, right? Like this is not a New Haven problem. This is a regional problem, and we're really trying to engage our partners to address that. And then lastly, I'll just say in terms of challenges, I think we've talked about this, you guys hear it over and over again, it really starts with the lack of deeply affordable housing. And adding deeply, some people are like, oh, why are we complicating it? Because we're really talking to people who are on a fixed income, maybe getting $700 a month. Where is a place that they're going to be able to stay? And so how are we thinking about the different types of housing, different costs of housing? And just the lack of that, Carlos talked about the vacancy rates and just being a huge challenge for us. And again, just continuing to talk about that it's a landlord's market. Even when we have resources, and we have in the last few years seen an increase in vouchers and other resources, people are sitting in shelter much, much longer because of the challenge of finding units and finding landlords. So in terms of the next steps ahead, we're going to continue coming together because really in the end of the day, no one organization or town or even state can solve homelessness alone. And so continuing to bring people together to figure out how to be innovative, get creative to do this work, as well as I mentioned, trying to talk with landlords, figuring out how we can really craft that and working together our municipalities. So we do have a plan, the Greater New Haven Alliance and Homelessness. In the spring, we'll be hosting a summit where we're going to be bringing all the municipalities in our region together to really start talking about what is a solution to homelessness look like here. I'll stop there. That was kind of a lot, so I want to just take questions.
Thank you so much for your presentation and obviously the work that you do. Ask if any colleagues have any questions.
Thank you very much for the presentation. Two questions. One is, do you guys track outcomes? How are people being able to transition into shelter and housing from the list?
Yeah, so we track everything from the time you call 211 to appointment to shelter and on. And so my amazing colleague back there, Margaret Lefevre, does a dashboard every month for us to track our outcomes. And so I'm happy to share that with you. When I heard you ask the question before, I scrolled to my phone, and so in the last 12 months, we've housed over 400 people in our region. And that does not include those who are diagnosed before. So I can share more. And again, those benchmarks are really important to us because we're always trying to make progress, right? Like shorten the time that it takes to seek services, shorten the time that someone's experiencing homelessness, and make sure they don't come back into the system.
Information. And then from this, in terms of your priorities, and we're going to talk about kind of evolution of the can. I'm wondering if there's anything on this list or anything else that you think we can do as a city that would really be a game changer and would really shift the trend.
Yeah, so I would say it's kind of on the two ends. We really need to slow the inflow into the system. Every day, Carlos, I think we pulled the numbers, like every month we add 120 people onto our shelter wait. And so we really need to slow those numbers down and help people stay housed, address their situation before. And I think that comes back to, emergency support, but also better employment programs and helping people earn higher wages, right? Like, so there's a lot on the prevention side that I think would make a huge difference. And then on the exit side, really at this point, it is about units, like needing more units and being able to access them as quickly as possible. And I think that there are different strategies we're seeing in other communities in the public housing options that there are, but then also other things like it's different kind of incentives for landlords or tax breaks, right? Like there's a lot of creativity that we can do to make this something that landlords have more, like have a better appetite for, and have that works for community. So slowing the inflow, but really helping us house people working. Yeah, absolutely. We'd love to have you all there.
Thank you, Alder Miller. Thank you. Any other comments, any other questions? Seeing none, well, thank you so much.
Thank you. We go to the zone meeting now.
Thank you very much, Kelly. I appreciate your partnership. Next, I would like to call Caroline Perez, Director of Housing from the Columbus House.
As always, name and address for the record. I'd also just like to mention, I do want to leave time for public testimony, so I'll just quickly ask organizations presentations 5 to 7 minutes, just so we have them as well. Yeah, I just want to make sure we got time. For some public
My name is Caroline Perez. I am with Columbus House in England. So I'll make it brief. Columbus House has an array of wraparound services with the goal of ending homelessness and fostering independence and growth for the individuals that we serve. So we have an emergency services department, which has our emergency shelter that serves 81 men and women. We have a medical respite program, which is a partnership with Yale, in which there are 12 beds for those that have high medical needs, who are not necessarily appropriate for shelter, but are not able to go back into the community just yet. So with that, we get our referrals directly from Yale. We have nursing services with APRN on staff to help with high medical needs, which creates a reduction in referrals to the hospital. We also have an outreach and engagement team. Earlier that they go out into the community, they'll go to the campsites, and help those individuals who maybe are really reluctant to go into shelter or have some reservations about getting housed. So we have 8 case managers, we have a diversion specialist who helps those who possibly could be diverted away from homelessness with financial assistance or resource connection. And we also have somebody who does homeless verification, so they'll go out into the community if somebody reports that they're experiencing homelessness. They'll go out and actually verify where that person is staying, which can help with the housing process, because our programs do require those to be literally homeless. Within our housing department, we have different levels of housing. We have a program called Rapid Rehousing, which is sort of a light touch. It's short-term financial assistance, typically 12 months. In rare cases, it can go up to 24 months. It provides case management services with the goal of those families or individuals becoming financially independent so they can pay the rent on their own. They again get employment services that we actually connect those families and individuals directly to within our agency. And those who are unable to work, we actually have SOAR specialists, SOAR, which is for those who need Social Security. They're trained to actually do trainings, and their applications are expedited with the Social Security Administration. So it's sort of a wraparound. In addition, we have a financial coach who can help with budgeting, because when somebody's experiencing homelessness, they don't have the bills that they're going to have if they move into housing. So the financial coach is there to help them create goals, to figure out where do they want to be, where are they now, and again, increasing income and helping to sustain their housing. We also have a veteran services department that's dedicated strictly to veterans. So they provide case management services. They also have funds to help them with housing, more specifically permanent supportive housing, which then brings me to our actual permanent supportive housing department. We have 2 types of permanent supportive housing. One is called scattered sites, which is where a client will get a voucher and they can live in the community with whatever apartment that they're able to locate that meets the specific requirements. The other is called single site, which is a specific dedicated building. Single sites have a case manager actually within that building, so we typically put our more higher needs clients there so that they have easier access to case management, so we can keep a little bit of them. The scattered sites, the case managers are located at Columbus House, and they go in the field or clients come to our office to meet with us. We at Columbus House have 17 separate housing programs under our permanent supportive housing department. Some of those programs target specific populations, those that are involved in the criminal justice system, those that have high medical needs, or those that are diagnosed with severe AIDS. We have currently over 200 households that are housed within those 17 programs. We have over 20 clients that are currently looking for housing, and we have over 70 openings for new clients. The challenge is staffing. So we have huge staff turnover, which is similar with our other colleagues as well. So we don't have the staff to be able to help case manage the individuals. So the binding list that Kelly mentioned, these are 70 spots that we really need for those individuals. We don't have anybody to case manage them. The other challenges we have are the lack of affordable housing, low housing stock, as well as the really strict landlord requirements such as no evictions, credit scores, or we get clients that have criminal backgrounds that then prevent them from being able to get. We also have within our agency a social worker who can help us with verifying disabled conditions because for our permanent supportive housing program it is required. And we have individuals who do not want to seek services with therapy or counseling. So we have an individual, again, a social worker who can help us to diagnose individuals so they can get them into housing. She also helps us with case conferencing, so to help us sort of navigate really challenging times as well.
Thank you for your presentation. Yeah. See if any others have any questions. Thanks so much for your presentation.
Thank you.
All right, thank you so much. I would like to invite next Dr. Jacob Teeps from City Campus. Good evening.
My name is Jacob Teebs. I live at 188 Armory Street, Hampton, and I represent the Consultation Center at Yale at 389 Whitney Avenue in New Haven. I'm here to talk about Elm City Compass, which, as you can see, is on your slides, Passionate Allies. It's a community-based initiative to create a system of sustainable services for individuals in New Haven who experience mental health or substance use crisis. So why am I here to talk about folks with mental health and substance use crisis? It's because the majority of the time, the people we serve, the mental health and substance use crisis involves a housing crisis, and particularly deeply affordable housing. Compass is a program collaboration of the City of New Haven, Consultation Center at Yale Continuum, as well as the Connecticut Mental Health Center, State Department of Mental Health Services, and Yale School of Medicine, including a number of the folks that you're looking at tonight, who also collaborate as system partners like Compass Chief. A few years ago, before Compass began, the initiative about 18 months ago, extensive planning process, which we heard from hundreds of people in the community, as well as 50 service providers, and out of that, we created a shared vision you can see here. The first part of that vision is to implement a crisis response team, staffed by a social worker with lived experience, complement and support the work of New Haven first responders, 911 calls, and through outreach. That's the core mission of Compass. But in addition to that is the second objective, which is to strengthen the crisis response service system through better coordination and integration of services and divert people from arrest, incarceration, or more restricted ED visits and hospitalizations. Third was to establish a community advisory board to ensure that Compass stays true to our community's needs and values. And fourth, to implement an evaluation that assesses quality assurance, the team, and the effectiveness of the program. And so that vision, as you can see in the next two slides, we picture here the Compass staff, leadership, and city partners, which includes police, fire, public safety, answering point, does the dispatch 911 calls, as well as our advisory board, which is an incredible group of community New Haven residents who are activists and advocates of their own right, who participate in quarterly meetings through monthly task group meetings and a variety of areas. So I want to tell you a little bit about Compass, particularly as it relates to housing, and then something about some of the work we're doing with the service system as it relates to housing. Compass right now is in its second phase here, the first implementation phase of this year. They're now in process for 1 year underway. There's now currently 2 teams from 8 a.m. to midnight, 7 days a week. We respond to the request of police and fire, 911 calls. We also do outreach. We also do direct responses to 911 for low risk health risks. Because of some grants that Carlos mentioned that Continuum has received, is able to do case management for up to 60 days until someone gets service. And as you heard from Kelly, that this is often an issue that folks have to long waits to be able to get housing and other services, and that's why the case management goes up to 60 days. Then we have the evaluation team tries to check to see how people are doing up to 6 months later. All the dashboards material that you have on the other bottom of that slide, but after 1 year, just November 1st was after 1 year of services, we had served over 900 people, about 55% of the time was outreach and 45% was to 911 calls. When we do a 911 call, 3/4 of the time it's a police that requests help. It takes about 12 minutes for the team to get their mobile van, and then 47 minutes on average they spend on the scene. Responses are 7 days a week and at all times of the day from 8 a.m. to midnight. On the next page, you can see there's 2 major kinds of calls that we do when there is a 911 call. A little over half are to people with mental health and substance crises, and then just under half are for everything else, resources and service needs, particularly housing that people need in response to a result from a crisis. On the right there, you can see that of all the people through 906, 53% of them are unhoused. That represents 40 calls a month to people who are unhoused. The mental health crisis is also a crisis. That's the root of it. Crisis response service referrals, as you can see, the ones that referrals that we made, 27% are directly for housing, either shelter or housing services involved. The bottom of the next slide shows the heat map of the 911 calls and the outreach calls. On the left and the middle, on the right is the very first direct response that we've done, maybe 40 of them without going through police or fire. There's crises throughout the city, and there's housing needs throughout the city, as the map shows. The next set of slides shows the demographics of people served. I would point you to the final little data that shows transport from the scene. About 20% of the time, we need to transport the team transport to the scene. That's the time that's to a shelter or a place where a person can get a meal, get a break, come down. That's in a safe and sheltered place. And then they move back into the home that they're in, but they're taken out of crisis so they can come down and return to care. There's still underlying issues that exist for that person usually. So that's an example of how the team's work overlaps with housing issues. Just at the bottom of the slides, we've done some work with service system partners, service providers, advocates, and field. We gathered with them this year, 126 of them. We conducted listening sessions, and they provided priorities for us to work on in this coming year, starting in January. As you can see, we identified 8 priorities. 5 of these are major priorities. Promote access, direct access to Compass, one of their priorities, and improve fire and police, 911 calls. The other 2 are directed to housing issues. The need to emphasize partnerships to ensure there's better coordination when people are in crisis, often related to housing issues. And the second one there, leveraging Compass to improve post-crisis services. The key post-crisis services needed is, as many more shelter beds, more opportunities for housing, more permanent housing, thinking of more housing. Other kinds of priorities are reduce, restricted crisis responses like arrests and incarcerations, and low plus for community members. And there's, the service providers also said that one, to reduce stigma and support training in crisis response, continue to collect data. So in January, we're going to reconvene again and start to work, develop plans to. There with the picture of our website, all our reports are open to the public, post them all. So you're welcome to go to our website and see what we do. We'll be posting our service provider in the next week.
Thank you so much for the presentation. I'll ask if any colleagues have any questions. You know, I do have just one quick question. I'm just curious, how has it been sort of thinking of Compass and then maybe PD and fire department? Do you think folks at PD and fire have quickly adjusted to joining that Compass as a resource? Take it.
They're very supportive. You know, as we've done a lot of programs over the years, and everyone's done programs know that at the very beginning, there's always a rough patch. What does it mean for the service I have? What does it mean for our work? There's always going to be that. There was some of that in New Haven, didn't last very long. PD and FD both felt that it is an additional resource, especially with the staff shortage PD. This has been a real resource that officers call. They can respond to a public safety issue and then not necessarily a mental health issue. So we have a very good partnership with PD and FD. PSAP has been very helpful as well. And we're now eager to be doing more work directly with community partners. All of them are doing the kind of work that really needs to happen on the ground.
Thank you. That's really encouraging to hear. Yeah. I mean, I guess I don't have another question, but I mean, I'm glad to hear that beginning to prioritize maybe exploring, direct 911 to Compass. I think the biggest thing I would in early discussion about Compass was waiting for people to show up at the scene, just so people who aren't immediately feel recognized or feel worried that something's going to happen because they're having something going on in their lives. So it's not much of a question, but more of a comment. And again, super glad that that's being considered and explored.
Yeah, it's always been our priority. Service providers' priority, community members' priority, and so right alongside of supporting first responders, at request, also be able to comment them through civilian crisis response.
Thank you so much for the presentation.
Thank you, Dr. Tibbs. We represent the partnership. I would like next continuum of care, Jennifer Vargas, Director of Acute Services.
Good evening, Jennifer Vargas, 109 Region Avenue, New Haven. I'm here on behalf of Continuum of Care, and knowing the interest of time, some of this might be redundant. So Continuum of Care has been serving the community of New Haven for over 40 years. Our mission is to enable people who are challenged with mental illness, intellectual disabilities, and or struggling with addiction to rebuild a new life and thriving communities. Some of the services towards our mission statement are housing, medical therapeutic services, peer support, training, and community integration, where we have served over 2,000 people annually. To highlight some of the services that we do provide, we have provided housing in our communities, where we have a housing first model, pilots model, Sheldon tiers, our banner tiers, where all of them are, divisions. We partner with the Department of Housing and HUD 811 and Haven Housing Authority. It's easy for reflected on the number and the capacity of the buildings and the people that we are able to serve in all these programs. Next slide, if you have right in front of you are the locations of our permanent supportive housing programs. To the left is our Dallas Ferris location, and then our Shelton Terrace location as well. In addition to the permanent supportive housing program, we have transitional housing. That also operates 12 to 13 transitional housing are funded by the Department of Mental Health and Addiction, with a total of 70 permanent supportive housing upon discharge from transitional housing. Again, to sound beat a dead horse, but deeply affordable housing is made available for folks that are SSI or SSDI. And many clients are on the wait list for Section 8 of public housing units since they're not eligible for public permanent supportive housing, and they also prioritize individuals. Our crisis residential services is a hospital diversion program that has been going for over 20 years at this point. We have served more than 200 people every year. Our average length of stay is 10 to 14 days, where we are working with hospitals, Yale, Grace, primarily most of our referrals come from Yale. Approximately 70 to 80% of those are homeless. And then to highlight our new services coming, I think I also spoke about this already. The Days Inn is coming hopefully right before the end of the year. It's going to be located on Fox Boulevard, where we will have individuals. Those individuals are also comparable to the people that we serve on our crisis programs. And then we have our REST program that's also on Winthrop Avenue. It's going to be a 23-hour rapid evaluation, stabilization, and treatment center, where it's going to be off living room model, where folks are going to be able to stay for 23 hours. So to help triage folks from cycling back to the hospital and preventing arrest as well. Hopefully we are anticipating 300 house expecting that. Sorry about that. And any questions you guys have?
Any questions from colleagues?
No, thank you.
Thank you so much for the answer.
Thank you.
Thank you, Jennifer.
Thank you.
Next, I would like to call Jean Bettinelli, Executive Director of Liberty Community Services.
Jim Pettinelli, Liberty Community Services, 210 State Street, New Haven. First, I want to thank all of the collaborators that we have with the city, all of the different departments. I want to thank the alders for inviting us all here tonight. I am very proud to be a partner with many providers that are here that work within the housing and homeless services sector. And I also want to acknowledge and thank the voices of the advocates that are really starting to ramp up, talking about their own personal life experiences and their needs. One of my colleagues, before coming up here, asked me what I was going to say, and kind of hinted at, sometimes I'm a broken record, because I consistently echo the same things over and over again. I consider that continuous orientation. Right now, if there are three things that you remember from what I say tonight, number one, we are in the midst of an incredible crisis. Number two, our homeless and housing sector has gone far too long under-resourced. And number three, if we want to truly solve homelessness, it's going to be all about housing. Liberty Community Services started back in the 80s. We were the first residential program responding to people living with HIV disease. We changed our name, we expanded who we serve, and right now, through one of our 3 program categories, which consists of housing and support services, prevention and diversion, and outreach and engagement, we're on track to serve over 2,400 people within our fiscal year. Coming back to where we are right now, we are in the midst of a national housing crisis. It's happening across the country. We are in the midst of an ongoing national opioid epidemic. It's happening across the country. And we're just starting to truly recover from COVID-19 pandemic. All of the providers here never came offline, continue to work 7 days a week with very limited resources. And we're just as organizations just starting to recover. We never worked hybrid. There's no such thing as telehousing. So that is impacting our work. Right now, everything that we're looking at is thinking about in the meantime. You heard the numbers. 700 people on the by name list that we know of. Over 200 people that are unsheltered, unhoused in some type of encampment situation that we know of. And we do not have the resources to rise up and respond to those needs. So everything that we're doing right now with your support is in the meantime, because we need housing. Housing is healthcare. From Liberty Community Services perspective, because we started in response to HIV disease, back in 2005, some of the early research showed that housing has a positive effect on people's health. Housing is healthcare. We need housing. We need affordable housing. We need deeply affordable housing. And this rise in crisis has been coming for a long time now. Maybe the pandemic impacted it, but it was going to catch up with us at some point. And when I look in the mirror and I criticize all of us together, it's going to be a criticism around housing. We've commodified it. We've built in far too much profit. There's not enough affordable options. There's not enough options. And together, and it's going to take us a number of years, we've got to figure out a way to respond actively to that. That's the answer. And everything we do for right now is going to be in the meantime. What can we do best to respond to people's needs? So thank you for listening. Nothing else.
Thank you for coming tonight. Yeah. I don't know if any other colleagues have comments or questions.
One, thank you for the passionate statements, which I really appreciate. My question is about that in the meantime, and even if we were to have all the funding to build all the housing, it would be many years out. So is there a way for us that everybody who wants to be in some kind of a shelter is in a shelter in the meantime? And if so, what does that look like?
So my answer is complicated and yet very simple. Things cost money. Okay, you ask a number of questions about, well, how do you really create more low barrier options for people? We have to find ways to pay for that. You know, our system has worked. Our system has been extremely effective. But as a system, we've been under-resourced by all of our primary funders across the board. And part of it has been on us because we've been so fiercely mission-driven that we rise up and respond time after time after time, and we have consistently figured out ways to do more with less, and that has, in a way, hurt our system. So you don't have huge pockets that you can reach into to access funds. But we collectively have to figure out ways to do that. It's you, it's all of our funding partners, and it's us as a society. This is an us issue, and it is going to require an us response and solutions. And I don't have all the answers.
Thank you.
Thank you.
Jim, thank you so much for your partnership. I want to call next Pastor Washington from Funds for Ministries.
Good evening, everyone. Valerie Washington, Funds for Ministries, 82 Grand Avenue, in the city of New Haven, the great city of New Haven, Connecticut. November 22nd, 2023 will be 1 year since I opened my church. People that are experiencing homelessness. Overnight, 7 days a week, and it's a bittersweet. In other words, we've seen people lose their lives, we've seen people get housed, we've seen people get jobs, reconcile back with their families, and they're able to go back home with their loved ones, all that are willing to receive the resources that are provided. They do, they do receive the access to resources in case they need it. Throughout this year, we have provided a safe space for 1,700 people. We provide our parishioners at our church provide hot meals every single night, along with snacks, hot coffee, tea in the morning as well. As the gentleman just mentioned, financial partners, we would like to meet them. I believe the city is truly underfunded. We at our church do a lot of out of pocket because they are in our church, and we look at them now. We don't look at them as people that are homeless. We look at them as a part of our family. These are daughters, sons, fathers. So we provide a lot of out of pocket expenses, and I share with Carlos and Velma. We're not looking to be refunded. We do keep our receipts just to show we're not looking to be refunded, but there are some needs that definitely need to be met, and we cannot provide, continue to provide it because it is expensive. But we do provide toiletries and clothing. However, what I'd like to speak about is in the morning when they leave. I do understand that homelessness is a great problem in our state. I was also homeless. I didn't know about these resources, but I would have had definitely resources. But I would like to speak really quickly about when the people leave in the morning, when they have to be out in the morning, if there was a place that they could go, and there are some places they can go to today, but then it's closed, and then they're left, just wandering around throughout the community and in front of people's businesses. If there was a place maybe that they can go throughout the day, which I understand takes finances, it might eliminate them just being out on the street wandering. And so that's one of the things I want to address, because I know homelessness, trying to provide housing is going to be something that will take some time. But there's somewhere we can provide for people throughout the day. Maybe them being able to take a nap, get some rest or something, it might help as well, because when you lack sleep, I know that there are possible illnesses that can be involved. And when they lack sleep, a lot of times they're irritable and they're angry and upset. And so I believe some way that the city could provide, somewhere where they could be throughout the day and not just that might help. But I also want to thank Velma and Carlos. This is my first year actually being a part of this, and I like it. We like it. So, what I say right now.
Thank you so much, first of all, for the work that you do and the parishioners do too. That's really amazing to sort of hear about that.
Oh, I would like to add, on Sunday mornings, every Sunday morning, let them stay until 9 o'clock. And we give them a big breakfast every Sunday, so we stay until 9.
Oh yeah, really, really thankful for you coming here today. It's your first year, so really happy we can point your resource out to folks, and also take into account sort of the concerns you brought up about being providers, and getting creative. So thank you so much again for coming. colleagues? Questions?
Another question is to say that I really appreciate that you always jump in with both feet. We got to know each other when during COVID.
Yes.
And I just really appreciate the work you do, always being willing to try new things and take risks on behalf of the people who need help.
Thank you. And Delana, she works with me. She's a nurse. She's from my church. She actually went down to part-time at Yale Hospital to work with me at the Mormon Center. And she took a big pay cut, but she likes what she does. So what you gotta know, right?
So much.
Thank you, Vice President. I'd like to invite next Mr. Amos Smith, President and Chief Executive Officer of Community Action Agency.
Good evening.
Good evening.
As Carlos said, my name is Amos Smith, and I'm with Community Action Agency at 419 Whaley Avenue. We are a partner with the city doing homeless work. I'm going to respond to something that my friend Jim said. Told you all what we thought. I thought he does one thing that there's another critical factor in the homeless population, and that's mental health. That's an issue that we have to solve at the same time. And Patty's going to tell you about the work that we do. But we've been doing work now with the city for about 3 or 4 years. And we found that we're doing the work with the homeless that are living in the camp. Some of the most difficult, rugged, dangerous work we do. But we're seeing a very distinct group of people emerge. Some at a low risk to moderate to slightly severe in terms of mental illness and difficulties with obtaining housing. And as a result of that, we've actually asked the federal government for planning to try and work with the city and other partners in the community around that. And so I'll stop at that point and have Patty talk about the work that we do.
So over the last fiscal year, well, first Patricia Tully, Community Action Plan, for the record. And so over the last fiscal year, which is July 1st of 2022 to June 30th of 2023, our hub, so we're a hub at Community Action. We saw 660 clients, which is unheard of for us before. Out of that 660, there's 361 that completed intakes and received formal services. And then 299 that only utilized the hub. They weren't interested in services. They want to charge their phones, meal, and go into upon the box point. They come to us during the day. We're kind of far from Grand Avenue, but around the intersection, that's where they come. We're safe. Just so you have an understanding of the numbers. So we're contracted to do 120 individual institution clients in the city. So we did 361, which is over a 200% increase in numbers for 1 year. So that's how much. And then to other points, so we had 120 obtain housing just through our program in the last year. We had 45 that obtained employment, and I mean, I can go on. Step 35, we had 10 who got enrolled in higher education and job programs, so they can get employed. But like what Mr. Smith was saying, our main concern is this 299 who are not ready to assimilate back into society and are on the streets.
Thank you so much for your presentation and again for the work that you all do. I'll ask if any colleagues have any questions. Thank you so much for coming tonight.
Thank you so much, sir. I would like to invite next Mary Rivera, Executive Director of the Fellowship Place.
Good evening, everybody. I'm Mary Guerrera, the Executive Director of Fellowship Place, 441 Elm Street. Thank you for having me here tonight, and thank you to Velma and to Carlos for the wonderful work that they're doing trying to coordinate home services and really have an impact on the problem that we're having in the city. Fellowship Place has been operating in New Haven since 1960. We work primarily with adults living with a serious mental illness or co-occurring substance use problem. Again, we provide permanent supported housing, education services, employment services, day programming, counseling, and skill building services. We like to say that we provide all of the services that people living with mental illness need in between their appointments with their doctors. Because most people that we work with are lucky because of insurance requirements, uh, cutbacks, are lucky if they only see a clinical service provider once or three times a month, once or three, every 3 months. Sorry, I apologize. So we are really the people that are holding these folks together in between those doctor's appointments and giving them the support services that they need to be as independent as possible and as fully integrated into the community as possible. We have operated a drop-in program for the homeless since 1995. And we have seen tremendous changes and increases in the number of homeless people over the last few years. And I'd like to share some of that information with you. But first of all, what we do in the day program for the homeless is give them a place to be from early morning. We open at 7:30 in the morning until 3 o'clock in the afternoon. We are there 7 days a week, all holidays. We provide 2 meals a day, breakfast and lunch. We have free showers, free laundry. We have lockers. We have places to charge phones and other devices. Place to take a nap. Place to just hang out and be off the streets. But what's really special about our location is that because we're located on the Fellowship campus where we have all of these other services, we are able to hook people up with employment services or skill building groups or other rehabilitative services that could help them hopefully move out of homelessness and into a more independent life. Just to give you a perspective about what kind of a crisis we're dealing with and how the problem has really grown. Before the pandemic, we saw about 150 people a year in the program, with an average attendance of about 25 a day. And if we saw 30, wow, we're really busy. Well, in the last fiscal year that just ended on June 30th, 2023, we saw 399 people with an average attendance of about 60 a day. For the first 3 months of the current fiscal year, that would be July, August, and September, we have already seen 370 people, and our average daily attendance is up to 80. The problem just keeps growing. I just want to tell you a little bit about who these folks are. Some of this is repetitive, but I think that sometimes you need to hear it over and over to just really grasp how serious this problem is. Many of the people that we see are actively using substances. Many of them have serious untreated mental illness. That is why sometimes it's very difficult for them to accept services or go into a shelter because they find congregate shelters very overstimulating. They have a hard time being close quarters with other people, so they choose to stay outside. A lot of the people that we see have no income. Some people are fortunate enough to be state assisted general assistance, which is SAGA, state administered general assistance, which is SAGA. Those folks get $300 a month. The very fortunate ones who are on SSI get about $800 a month. The other big growth in age group that we're seeing are older people. So last year, we saw 60 people over the age of 60 who are homeless, have multiple chronic health problems, heart problems, diabetes, lung problems, mobility issues, and untreated mental illness. So we have people coming to us in wheelchairs, walkers, with canes. We have one gentleman who comes to us, he has 2 canes, and he carries all of his belongings everywhere. We have people that come to us with portable oxygen tanks. And these people are old, they're very, very vulnerable, they've had very, very challenging lives, they don't have a lot of income. And it's wonderful that we provide outreach workers and day programs like ours, that have warming centers and shelter beds. But what these people really need, because they're so vulnerable, is more deeply affordable housing. And I want to put in a pitch for site-based housing. The trend in the last few years has been to solve the homeless problem by giving people a voucher. They get a voucher, hopefully they find a landlord who will accept that voucher, but a lot of people fail when they just get placed in an apartment with a voucher, with a landlord, maybe not that friendly, the neighbors in the building that aren't really sure what to make of this person who came in, maybe looks different, acts different, seems strange, has strange friends. So a lot of the people that we're seeing now, part of the increase in attendance that we're seeing are people that got housed with vouchers and then lost their housing. So now they're just, coming back into the system. And I think that the reason site-based permanent supported housing works best is because when you have people that are very, very vulnerable, and have multiple problems, they really need a lot of wraparound services. So they have an on-site caseworker, they have peer support from other people in the building who have serious challenges. It's really what a great way to make a positive impact. Is it easy to develop new site-based permanent supported housing? No, it's very, very expensive. It takes time. But if everybody came together and decided that this was a model worth fighting for, and we leveraged city dollars, state dollars, federal dollars, I think we could really have an impact in improving the quality of life for some of the most vulnerable people that we're seeing out on the streets.
Thank you so much for your presentation and for the work that you do in your organization. I'll ask if any colleagues have questions. No, thank you. Thank you again so much for coming tonight. Albert, that comes to the end of my presentation, and
asking the touch to use.
yeah, we do just want to put out, maybe ask if there's any other organization out there that work with our house population would like to present. Yeah. Yeah, that's for you all. Thank you for coming. I appreciate it. You all on stage. hopefully,
Point of clarification, Mr. Chair, any organization else in the city, the public testimony.
okay. Oh, yeah, yeah, thank you for that clarification. Yeah, in that case, we can start with, on the list. Okay. All right. So you're down third. So we can start with Billy. That's the first person on the list.
Couple of organizations. Keep the order of desk is here.
Okay. Right.
This is a lot of orders. I would just follow the list that you read.
Yeah, I think we'll follow the list. There's only a couple names up here, so yeah, sorry about the confusion. But yeah, Billy, if you want to.
Just name and address. My name is Billy Brumage. I live at 49 West Rock Avenue, New Haven, Ward 25. I want to thank the alders and the committee for having me here today. And I want to thank especially Alder Gusney for including UAC organization part of in the conversation about the $4.8 million in housing dollars. I think it's very important to have someone with lived experience of being unhoused in this conversation. We've yet to have heard from anybody tonight that is unhoused. We will in a little bit, but I think that's really important to consider that we need to hear from people that directly are affected by this, often our lifetime residents of our city. I just want to quickly say I'm here as not as a professional, though I've worked in this field for over 20 years in the mental health field. I'm here just representing myself and the organization that you act in part of. We framed this issue as a human rights issue. It's too serious really to be framed in another way. And I think when you frame it as a human rights issue, it's important to think about that there's a public responsibility to this. There's something, so I want to just speak tonight. Alder Miller's asked a few times about what we can do in the meantime, and I want to give a few things that I think are policy things. In the meantime, as we more housing in the city. One is I'm going to stand this as a word for word from the Rosette Village about building transitional, inexpensive homes that create communities. I'd like to see more of that on public land. As some of you might know, there are many cities around the country that have built small, tiny homes on public land. Burlington is a recent example. We talked about that about a year ago when we were here. The current mayor has told us that's not going to happen. I would love to encourage the alders to think about that differently and to push that as one part of the solution. I'd also like to say that we really need to have a hiatus on any construction of encampments. People are in places that might not be ruled by some people as ideal. I don't think most people would think it was the best place to live. That's where people are and where it's safe. It's really important to have a complete hiatus on construction. We saw it happen on the boulevard in March. We saw what happened under the Lamberton Bridge. People placed, people under very unsafe situations. And it's really important that the city does not destroy these encampments that are. I'd also like to say that I was in a lot of the warming centers last year, and something we're talking about today. I don't know if you visited them, but people are not allowed to lay down, or they're not allowed to lay down in a way that any of us might consider a decent. Part of that's fire code, part of that's because of the way that shelters are designated in the city. I would ask the Board of Alders to look into that. I think it's really, frankly, maybe to really, if our goal is to not have people freeze, I think that's really a very, very low bar, an incredibly disrespectful bar. In fact, I think people should be able to lay down when they come to a place to sleep and not just under haulings on the floor. I think that's completely disrespectful. I also want to encourage alders. You've heard a lot about services, and the services are helpful to a lot of people. But I'd like to encourage you to think about that the services are not the only pathway to people. People have been called things like defined and not the services and the solutions we need more services. I think we also need to consider that not everybody wants to be in services. It's really important to think about that. We think about people first as residents of our city, and then secondarily as people that might be fed into the service system. I say that because I think it's really important to think about things like SROs and things that are places people can live independently but don't require, sorry, that don't require somebody to enter a client role. Some people aren't going to do that. And it's not because they're trying, it's because they don't want to be a client. They don't want to be seen. I think that's really important. I also think it's important to build on what I think Ms. George talked about a while ago about the shower, public shower. I think it's important for people to have a place they can go and take a shower where they don't have to enter into the client role as well. Most of the showers in the city right now that are available to people that are require you to enter into a program. Not everybody wants to do that. Some people, it's traumatizing. It's just not the way people want people to encourage that. There's just two quick things I want to say. That we need, we were talking about this actually today on a call. We need you actually talking about public restrooms that are not, you probably, I mean, you see it, you go into meetings or you see the green. That's where people are directed to go. It's disgusting to me. And that's kind of the solution right now, that those are paid for by the city, they're proper, taken care of supposedly. I think it's actually discriminatory towards people that are unhoused and the residents of the city, that that's what they're really to go to the bathroom. I think it's a horrible situation. I think we need to be thinking about how we do public bathrooms that everyone can use, whether it's somebody that's on the bus with a toilet training toddler, someone that's recently out of prison that's been told when they go to the bathroom and is having some problems with continence. They have a place to go that's dignified. It's not those porta potties or begging somebody in a restaurant to use their bathroom. And the last thing I'll say is we need a place for people to keep their belongings safe. A few people have talked about having places where somebody can leave their stuff there in the day, if they need to go to work, if they need to go to an appointment, not carry around belongings all day. The city put out an RFP for $25,000. UX spoke to some organizations. No one can do a thing with $25,000. We need to get more serious about that, whether it's money or whether it's convincing people to have some space to put some of this storage. It needs to be downtown and it needs to be funded better so people can actually do it, because there are working people downtown, or it needs to be done in partnership with some of these guiding systems. I thank you very much for your time. Oh, questions?
Thank you for coming here tonight, as colleagues. Thank you. Next up on our list, we have Alexis Terry.
Hello. Good evening. My name is Alexis Terry. I'm in Haven. I'm here as a member representative of UACT in defense of the human rights violations as I see it. Mental health was mentioned a lot up here by the different service providers, and so I think there needs to be more focus from the service providers on like more motivational interviewing skills. Perhaps there's a lot of fun in there, pay incentive or something, pay increase for workers that are there, since seem to be expressing a need for more employees. So so I realized that a lot of people who choose not to go inside of services, everyone seems to be at a loss as to what they can do, if anything. And I know there are various people from different organizations who have tried. I still believe people have unseen disabilities. They're not visible on the surface. They have mental trauma. They have had childhood trauma, and now they're, well into their adulthood. I know a gentleman personally who was homeless over a decade ago when I was, and is still homeless, and asked him many times why he was provider food services. And the fact, man, like he told me, he just lost faith in the system. Um, I guess he doesn't feel heard, or maybe his trauma is too deep. Where once he gets in there, like I don't know what it is, but I feel there needs to be more work done because I still see this man a decade later And I also wanted to talk about once a person is moved from a house situation into housing, there's also the matter of negligent landlords or discriminatory landlords, landlords who aren't responsive to structural complaints, and then that puts the person who's already in crisis back into crisis, even though they're housed. And so I'm not entirely sure that current case management is like adequately equipped to handle people who they have already put in a house situation, for them to then re-enter to the homeless situation and then have to get rehoused again. So I feel like the influx we're seeing, the huge rise in the first 3 months of this fiscal year, has something to do with the fact that we're already housed, going back into homelessness situation, and in the case that their particular situation would go into an eviction court, it's just really hard to prove that. Or a person who has significant trauma from childhood, they may be triggered by the fact that they always have to self management. If it goes to court, then it becomes like a representation issue. The advocacy and the representation comes from the system. That's just re-traumatizing the person and making them feel like, no matter what they do. I've also known a person or two who once they do find housing, they never seem to get out of the transient mentality, and so they'll stack their stuff up in the same room that you're in, and maybe pitch a tent in the room. So there's a lot more work to do. Everyone to stay, everyone who can vote, to look at things more integrated.
Thank you so much for your testimony, for coming here.
No problem.
Next up on our list, we have Evan Serio. Apologize for maybe mispronouncing.
Go ahead. Oh. Hello, I'm Douglas Dumas. I remember you before, I've been here before, last time we had the last mayor. It's something I wanted to throw out because I've been on this journey for a long time. I worked with the Columbus House before, and then I also done the other side. One thing I learned about this journey here, you know what I mean, is that we have to understand that there's so many demands. Put it like this. I had a vision about demands and solutions, right? There's been so many demands put forth in life. Some been met, some haven't been met, some still trying to be met, But when demands are met, when we do come to a solution, is that really the solution, or does that mean that, hey, we gotta work even harder so we don't have to come back down to this point? All right? So demands really have temporary solutions. So that's why we're here. The solution for all this right here, everybody has to be involved, and it's called family. We don't have the family support no more. That's why it's homelessness. That's why it's domestic violence. That's why kids are killing kids. Because we don't have the family there no more. You don't have a father there telling the son, yo, you gotta work. Like a father. We don't have a parent in the household telling a kid, yo, you're a good at your mother plays, your father, like I was told. You're a water gun. A water gun now. I got to run in the house. You know what I'm saying? We have the solution to this family. And what I say is, we have to come together as family. We have to get these homeless people that's homeless. You have to find out what kind of support do they get from their family members. I've been around, man. You look at their faces, it ain't about housing no more. It's about the love that we need. It's what's needed. It's the love that is needed, man, for the solution. If we don't come with love, how are we gonna come up with a solution? I these meetings all the time, talk demands and put things on politicians and blame police officers. But you know something? All family members too. So I'm saying, some of y'all are sitting here trying to support homelessness, but you got somebody homeless that you don't even support. That don't make sense. The most shameful thing is the veteran. Are you serious? This place would be full. Full right now. With veterans homeless. Are you kidding me? What kind of world are we living in? That's what y'all gotta look at. Everything that you do now, you gotta do it with your heart. Do it because of the heart. Do it with your heart. Nobody is exempt from any crisis that's going on in the world today. I don't care what it is. Not one American is exempt from what another American is going through. So not a family member is not exempt from what another family member is going through. God can't help them. Nobody said you have to take them in the house. But God says show them love. Are you okay? Find out who is their case manager. Do this stuff. You know what I mean? Well, we had a big gathering, a family gathering, family members and family members that are homeless. You know what kind of stuff will come out of that? What kind of men come out of that kind of stuff? You see people living with their family after seeing them homeless for 3 years. You know what I'm saying? You hear the sound of, hey man, I kicked you out. I thought you were gonna come back. I didn't know you were gonna stay away for 3 years. The pride, you know what I'm saying? The shame. That's what's so crazy about homelessness. Can't even tell who's homeless because people don't want you to know they're homeless. You take a shower and put out on the green. Yeah, that's gonna get a lot of homeless people there. Cause they always pretend. You don't want you to go homeless. Until you become homeless. They try to resource these programs and stuff like that. Go and check. Don't sit here in front of a desk come on, oh, we got these numbers. Go check. Go check. See, during the time when you heard it, the crack, yeah. Oh, I gotta keep it out. Oh, I gotta keep my apartment. Now you hear nothing. Why? Why? You know why? Because you're putting them back to the same area they came from, where somebody just got shot. Oh, somebody just OD'd in this apartment. On. It's not about homeless, it's about better living. Not homelessness. It's about better living. You can't just put these people with slumlords, all this stuff. You got to find the better living. That's what they want. They want better living. That's what this is about. Building unaffordable. Who that better living for? That better living for? We got somebody right downstairs. When you vacancy, somebody right downstairs, the guard tells them you got to go. My. What kind of heartless people deal with in this world today? When we do things today, man, you got to do it with your heart, man. Understand this, man. Family is important. Yeah, we can't keep going on in life like this, man. The family broken up in life. Cannot do it. Otherwise, we're going to always be homelessness. Kids going to keep on killing kids. Parents ain't going to have no more rights. My mom says, God, you got to love. Not no frustration. The reason why I got out of control. You know why? Because a young girl don't know how to teach a young man how to birth, how to birth. When he cry, what to do. You know what I'm saying? I come from an area that was taught you. Because he went to work. So when he came home, he was there, he knew how to take care of my father. He knew how to make water, parenting skills. All this stuff has got to come into play now. More family counseling. You know, bring all this stuff up, man. We gotta make sure who's in the position is who they are. not just there for the position. Today, it's about your heart, man. It's about your heart. You have to think about your heart. You can't just go and think, oh, like, bulldozer, how many times did I did that? Was that the solution? No, still here. Okay, keep people kick off this country. Oh, wow! Wow, 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 wow. One after a man that's using his heart. Love him to death. I love him to death. I love him to death. Dr. Phil. He's a doctor. Yo, his heart. He does that with his heart. Come on, make sure all is all right. Yo, that's a family member. How you feel as a family member you kept walking by this all the time? You know what I mean? And all of a sudden you come over, hey, you know, Uncle Jed died. Uncle Jed died. Yeah, look on the news. That was Uncle Jed in that sheet. You know what I'm saying? Family is a solution. More family support. Let's change that law. Let's really change it. But out of love, this young generation, you know what I'm saying? And men again, gonna be motherhood is gone. The motherhood is gone. The motherhood is gone. The sisterhood is gone. The childhood is gone. That was family. Come on. It's just that simple. It's nothing to think about. Family is the solution to what's going on. And if family don't start realizing this as members, it's gonna keep going on and on and on and on. We need more family support. It's not about the housing, I'm telling you. It's about the people you love. You need somebody there. You can put a person in the park right now. It's just an apartment to them. There's nobody coming in and say, I love you. There's nobody, you know what I'm saying? It's not about the housing, man. It's about the love that's needed in the world today. The world that needed with Americans today. Especially the American family. What happened? Come on now. We can't do this as Americans. Go on with life. Focus your family. Thank you.
Thank you. We now have I'll let you go first.
My name is Evan Serio. I'm program manager for Downtown Soup Kitchen, 66th Street. I'll not keep you any longer. Make sure that we get through everybody else. I just wanted to, a lot has been said from our service provider partners, and I'll touch on some of our metrics at both the soup kitchen, the pantry, and our drop-in center, as well as the low barrier center that was mentioned that we administered last week. Just for some quick metrics, we do about a year. Our pantry is over 1,500 clients, including those on the street. And our drop-in resource center is a specific program that we administer. Sees over 600. I apologize. So this year, with over 19,000 visits. We are only open 5 hours a day. I think that the scope of the issue and issues at hand, horses we have been, however, need for a diversity of tactics is obvious. And the issues that folks face, the ways that they end up experiencing homelessness, and what that means for entities is quite. I had some very funny questions earlier, Alder Gustavo, but low barrier. Love to have that conversation. Our low barrier overnight warming center, last year it was winter 2022. It was great. Saw almost 700 clients, individuals, 5,500 plus visits. They were allowed to come and go through it. Truly low barrier, meaning that we had our folks who were living hard sleepers or those folks who were deciding to sleep outside, would be able to come in and have something to eat in the middle of the night, or use the Wi-Fi and head back out. This year so far, year to date, we've had 20,000 visits from 1,600 individuals. Over 430 of those are as experiencing homelessness. That's this year. Our main focus is to, as other organizations do, the full case management services. Our focus is to find the gaps in those systems and to fill them so that our partners who administer full case management, housing case management, use the most time possible with their clients to focus on housing, which is a resource. So we see our services at the Drop-In Resource Center as a front door, not a one-stop shop. And so what that means is that you can come 6 days a week and access behavioral health services, medical services, housing, home connection services, assistance, government benefits, so that all of their time can be spent with case managers focused on housing. The question preceding this meeting about complexities, challenges, is a great one. I am personally very proud to be working at desk going on 7 years. I can talk about what we've done, but focus support is there is a bottleneck before we even get to the housing. The amount of housing supply that we have, which is that a small dollar figure could have a huge impact on the amount right. Vital documents cost quite a bit of money for individuals to procure. Anyway, gracious with the ways that we were providing flexible funding for that, and unfortunately, that was no longer available because it was COVID focused. City found that extremely helpful to folks ready so that come available. Better invoicing and partnership with those who are actually the city, a through line from providers to the vital statistics department, and our individuals could within and the agencies that they are a part of would read using that partnership. As of right now, service providers have to walk physically in with their client to use them. Clearly, the amount of affordable housing is the largest issue. However, another small fix, which could have a huge ramifications, is there was a project that was funded was the Parking Authority last warm summer season, which was phenomenal, particularly for our local clients, and as we there are a lot of folks with mobility issues. Transportation between warming centers, between medical visits, very specific That is not an end all. And if we hit capacity at a learning center that is a walk-in service, have to walk to the next one. We figured out how to have a coordinated access for overall services like shelter, where if you're not guaranteed a bed, if you show up, you are the person in line for a spots, you don't have to go across the city again. Transportation could just the low barrier nature of services, I think, could be better defined. The way that we did so, and I would highly support other agencies in taking on this type of role, is that if we get it must serve the purposes of the client and not be used as something that these metrics governors. Policies should be boundaries, healthy boundaries, and not. Our hours should be responsive, and folks should have a freedom of movement. I mentioned that we were open throughout the evening, and it will long ago, which meant that people would smoke a cigarette instead of starting a fight, or which we were centered on our assessment. We had direct input on how services administered. It's the strong work that our partner agencies do that must be done in conjunction. And I think what you heard us is that yes, we accept that drug is a fact of life for some folks. The opposite of addiction is not sobriety. I think that was Mr. Dimas's point, is that love is really the point. That connection means that we should just plan for the safety, what we would do if somebody breaks that rule to their living. I believe all of our other great as far as the CP have covered everything else. I would very much as the manager on call last year for the entire time for our low barrier warming center. From an administrative perspective, I could be more than happy.
Thank you so much for coming. I don't know if any colleagues have any questions.
I'm just saying, I really benefited from visiting several times, and so if it's not bad, I encourage you to go and see what Desk is doing. So I learned a lot from it.
Thank you so much.
Thank you.
Last on our list, we have Jacob Miller.
That's for last. All right. My name is Jacob Miller. I live at 207 Rosette Street in New Haven. So first of all, I wanted to thank you guys for inviting, people outside of traditional service infrastructure to come and participate in this conversation. I think there's been a lot of excellent points made, a lot of really, really big challenges that we have limited resources to use to kind of address. And, obviously pretty late. I'm sure everybody's pretty excited to go home. And so I'll keep it quick. But I also think it's, important to contextualize the fact that most of us have a place to go and warm and bed to sleep in and supporting people around us. And the reality for a lot of, people who live in the city is so I'm here today to talk about kind of a different model to many of the testimony that we heard today. And there have been a couple of people who mentioned kind of this supported site idea. And I'm kind of here as a representative on behalf of a collective associated with what we're calling the Rosette Neighborhood Village, which you may have read about or seen in the news. It's essentially 4 emergency shelters that were constructed by a private organization on private land in the Hill neighborhood, given essentially a neighborhood response to providing shelter to what we consider to be our neighbors. And looking at it from that framework, we've heard a lot about the kind of restrictive nature of shelters and the reality and the manifestation that early checkout, that these members of our community are often kind of sent out to mostly Fairhaven and the Hill section of Haven as these organizations, the overnight emergency life-saving services that they provide. We've heard a lot about warming centers and these kind of, in many ways, I think we can all acknowledge kind of a very low level of emergency service provision that's essentially keeping people from freezing to death, right? And what I'd like to kind of, and I actually, this is kind of a new idea for the city. For many years, actually, towards the start of COVID, I participated in a group that was at the municipal level at George, where we looked for the ideas behind these tiny houses. There wasn't too much that kind of came out of that in the form of action. So in the wake of the demolition of the city on Elmcross Boulevard, the Amistad House, which is where this development, this project that we're calling the village, has kind of come up. In an effort to address that, went about kind of building a coalition of people who had a myriad of different skill sets and raising some money through private donations to purchase and build something that we hope can be a model for a different way of serving these communities at the municipal level. The manufacturer that builds these kind of homes is not a fly-by-night organization. They have deployed thousands of these units across the United States. There are various villages of this nature in the East, so they are appropriate for this climate. One of the most important things about them, and I know we have a short period of time, and I really want to be respectful of that, but these are the ultimate low barrier and low cost option for this. Are rapidly deployable. In the span of one day, we built all 6 of these structures at 203 and 207 Rosette, and they were ready for, well, I'll get to that at the end. They were theoretically ready for occupancy that same day. And if you look at the PowerPoint that I provided, before the presentation today, you can see real world examples of other municipalities that have engaged with this kind of collision approach. And you can also see, you can see kind of I have a couple of them here from South Carolina to Boston, Massachusetts, 60 shelter communities that were assembled in 10 days. I'll find one that I think is really important because I want to draw on the motto of UACT, who's had a couple members speak. The emergency really is tonight for this population. And while we all get to go home and sleep in a warm bed, there are a lot of people who don't. And this South Carolina project, I think, is particularly interesting because from the day that the city originally held power to the day that people moved into these units, 72 days, right? This is a solution that can be deployed at scale quickly. And, the other thing that I think we've heard a lot from a lot of the different service providers is that there's limited funding for this service provision. And when you look at the unit economics of projects like this, way that most addressing these issues. Ground up residential development is not going to solve this issue. You're not going to fill the vacuum of need with apartment buildings and other traditional means of creating housing stock. So I think it has to be something that the city looks at as part of the framework of certain provision for our unhoused neighbors, at the level. And we encourage, I know a few of the alders have actually come by and seen it in firsthand, and we encourage the rest of the board to come take a look. One of the reasons why we did what we did was to give the city not just, a spreadsheet that says what it would cost to build development, but actually something that they can look at, touch, feel, walk inside of, and understand kind of, how much of an upgrade that is from sleeping on the street, sleeping in Union Station, sleeping in all of these places that we all, know is the reality for a lot of people that live in this city. And again, I'm not here to make negative comments about anything that the city is doing. But I think it is important to contextualize financially. When we compare something like this as a solution for this population with something like the hotel development, by the time that's said and done, we'll be into that for $2 million. Right? And we're doing a net 57 units, 112 beds. I don't remember what the exact number is. To net 112 beds with, in your packet, you can see examples of not only just the units themselves, but also modular bathroom shower facilities, handicap accessible modular bathrooms, laundry facilities, all of the things that you need to meet people's basic human needs. I have a financial model that I can share with you guys where we can net the same bed count for a little under $2 million. So I think it's not an idea. It's not something that we as a collective are cutting with us from a national perspective. It's just the first time that anybody has tried something like this in the city. And we are actually right now collaborating with the city to try to, kind of seeing within some of the articles about it, to create a zoning and a building framework to accommodate within, what everyone is admitting are 100-year-old zoning codes. And the last thing I'll throw in, because I know it's almost 9 o'clock here, anything that the Board of Alders can do for us in expediting getting the electricity turned on at Rosette Neighborhood Village would be greatly appreciated, because it seems like a real travesty for us to have built these structures and be actively servicing this population and not electricity. Just a little wrap up. And I understand that there's we don't fit into the traditional box, but they're there. The need is there, and we just ask that anything that can be done to help us get that electricity turned on, we would greatly appreciate. And again, thank you all for giving us to think about this and answer any questions. I'm sure I didn't get everything on my list, but I want to be respectful of it.
Thank you so much for the presentation. Also, just maybe next week till the end. I'll just ask if colleagues have questions with all their remarks.
Visiting.
Absolutely.
I'm very interested in numbers. Watch how much some bills and the
Sure.
expected, and if it's monthly or annual maintenance.
Sure. So, we don't have hard numbers on things like utility costs because we don't have utilities on. But we'd be happy to give you those 6 months after the utilities turn on. So yeah, the landed cost for these units is around again, I'm happy to share the model that I have with our price tag at 100. But here I have it open right here to give you some basic numbers. So we talk about people looking for things like bathroom facilities. They're modular handicapped accessible bathroom units are in the neighborhood of $40,000 landed and installed. The 64 square feet units with all of the, upgraded insulation, what we did, all of the like bed holding bunk beds, the mattresses, the heating and cooling, etc. We came in right. The 64s were landed 16.5K, and the 100 square foot total occupancy landed are like 22K. What's your question? Sure.
Maintenance or upkeep costs?
Yeah, I mean, we're expecting like.
I think we need to be careful about what's before us this evening. I think we most definitely should have a hearing addressing this issue. But this is not what's before this committee this evening. I will take good care of getting involved into this discussion.
Thank you, Majority Leader Philip, for correcting me. It's an exciting topic.
It's up to the chair to.
Yeah, no, I think, I'll recognize that point. I definitely agree there should be another space to specifically focus on this. I will say though, I won't discourage any colleagues from so, but yeah, a whole nother.
Oh yeah, I can talk about this all night. Tie this into what we're talking about is this is a very low cost option for addressing an underserved population. We heard a lot about people who don't fit into the traditional local service shelter infrastructure. These as an option provide autonomy, dignity, privacy, and one of the best things is they force community. They're designed to be built around each other, built around communal facilities that encourage, because one of the things that, a lot of, and again, I wish we had more time, and I appreciate the fact that we're going to be able to address this maybe more depth in the future. But, hearing it from the people who are living in Rosette Neighborhood Village is the best way to kind of realize what this means for people in that situation. Because when you're on the street, it is everybody has a very the myth of scarcity is very real, and people are focused on survival. And what this does is it kind of forces you to learn how to be a neighbor again, live in community with other people. And that's really that's what we've seen kind of in our little version of this model. So, that's the tie-in of what we're talking about tonight. We can address these issues and do it in a way that's responsible and economically viable. No ground up development until it's something that's being built by the government itself is never going to address that. Again, professionally, I'm a real estate broker. I have been for a decade. Well, technically, real estate agent. I'm a real estate broker. And I can assure you that there is not the incentive or the economic reality to solve this problem with residential development. It's just there are a couple really streamlined, sophisticated organizations like the Home Pros who are able to do these affordable housing developments. But there are just not a lot of people who are willing to lay out tens of millions of dollars to build affordable housing because the incentive profit motive, for better or worse, just and that's the reality. Is it right? Is it reality? So if you think like this, you need to incorporate them into the broader strategy in order to, have high impact with low resources, which is really that many municipalities ourselves included are in.
Thank you so much. Just asking any colleagues and any questions or comments. Thank you again for patient and patience.
Appreciate you guys giving us the opportunity.
Yeah. I was going to ask if anyone had comments, public testimony. Yeah. Oh, yeah. Yeah, preferably, I think if anyone who has a raise your hand now, maybe.
Opportunity. My name is Chai Kwan of the Monk family. Um, so a little testimony, my little career that I have. I appreciate the nonprofit services out there that's doing their part. Um, Some resources, I heard two key things was love and tradition. When has it ever been American tradition for us not to support our so basically I came up here because I've been very observant of things, homelessness is affecting all creed, status, color, and I'm seeing it affects everybody. So the second thing I'm worried about is that New Haven used to be a safe haven, and we allow a lot of refugees to come in and asylum seekers. So is there a separate budget for those who come in to get past hotels and housing, clothing vouchers? So is there a separate budget? Asylum seekers, a budget for homeless people?
Typically, it isn't, Mark Walder's thing to answer questions from public testifiers, but, as far as I'm aware, statewide, I don't think there's any thing like that. A good question to ask. Um,
Yeah, you said, and that's the arguments a lot of people from different countries are taking jobs as well. But I just want to share that, my grandmother's a pioneer of New Haven, to be a monk. So she had, she had a safe haven for people on Cedar Street. They named her after her monk crossroads. So that's how I wanted to share my testimony. I said, I got this. I got to donate clothes. I got to give out food to the people, over there in Tent City. But moving from food to the ground, we definitely could do better. We definitely have the resources. I just think that coming to, yeah, right. A collective of minds can brainstorm. We did it before while we are next America, right? And we forever have to keep that picture in us. As an Aboriginal American, I have to stand on that. We have funds, we have emergencies for people coming in from early 2000s, 1900s, 1700s, 1600s. So this is the way we're going. The resources are there. It's about the and the resources. And it's about infinity, I'm sorry. Not corporate wise, but actual wise is there. I seen it. And it took me to email my mayor. Thank you for my public support. It took for me to email my mayor to get into it. So basically what I'm saying is like the person was saying, have some people go check on relationship. Not the people get treated. Everybody's not on drugs or coming out of jail. I lost my job fighting for my dude. I was at Yale for 15 years. So her mom passed away. That order period I took like for my dude. And I still lost that people with it. That was taken. Did money, did multiple drug tests. So everybody's not just on different levels affecting everybody. I ain't gonna overwhelm me. I can deal with y'all.
Coming tonight. Okay, fine. So anyone else, just to testify? Uh, if you want to, testify.
Uh,
Name and address for the record,
yes,
please.
hello. My name is Philip Paris, P-R-I-S. I'm currently housed at 10 Crescent Street in New Haven have been for a few days now. I'm a person who has struggled with addiction and mental health for a while now, in and out of active addiction and periods of recovery, sustained sobriety, and I have experienced homelessness and recently. Basically, it's like awesome to be here and to just like connect and hear people like ask questions and like share ideas and exchange ideas about how solutions and it's messy. I'm grateful. I just want to say, it's hard to. One of the things that I'm experiencing right now, struggles with addiction, is I don't somehow there's some kind of disconnect, and I do think I have a right. I just felt that sometimes that I don't. That is just as valid as anyone else's, regardless of the fact that a lot of my problems are self-imposed, and self. My, my struggles are. I don't know. To be brief, and I know everyone wants to. Question of really wanting to. Sorry, someone's distracting my thoughts. So one's patience. It was really awesome to like hear. Sorry, my thoughts go a little. I appreciate you guys. I'm quite done sharing my thoughts yet, though. Thank you. Thank you for saying that. It can be really. Thank you. Thank you. I have a sense that like I just have this feeling of because other people weren't addicts or or struggled with addiction at a certain point, my issues are less valid somehow. My issue of needing to specifically arrived at this thought that to where we go from here kind of thing. My life is specifically in multiple steps of sobriety over the last 8 many rehab stays and many opportunities to get well. I have continued to struggle, and it's all that here I still am, and that here I still am. Reality that is reality means that still that I need to. I still have feelings, and I still be, and I don't know exactly how to express what I'm trying to say, but last thing I want to say was last couple of days. It's this feeling that I really did experience as a person, unhoused person, whether it was sort of voluntary or because it's just like, I don't know, I had to be stuck and just I ended in this cycle that I don't understand. I mean, I don't want to kind of grab to try to understand it and work with it. But the last year, I guess just like I don't want to underestimate the value and the importance of just like listening, being present, asking questions, listening on a very micro level to human they're experiencing. And I think that has, for me in my life and in this moment in my life and many other moments in my life, brought a great sense of healing and potential to be taken in. And like, I guess say like let's all continue to like learn from each other, grow, and be perfect at communicating and like frustrated. Like, dealing with addicts, addiction, I've been on like both ends of it, and it can be very confusing and frustrating. And dealing with the homelessness, there's in trying to like show up and be of use to people and help people get more stable. It's confusing because it's also like enabling and allow like be more comfortable in my addiction. But I think it's because I need I think that that's like a too simplistic of a perspective. Like, does the addiction cause the disability and the lack of housing, or does the lack of housing sort of make the addiction cycle worse? How do we like random things that pop out while I was listening? What do they do? And then I actually am gonna stop. Oh, yes. Just want to point out, I express my gratitude for the people that are still here right now, whether they're forced to be here or not. I don't know how many people, there are just a lot of people who had wonderful things to share and say. We wish were here, but some of the testimony, hear some of the testimonies. Often, my grandmother who was homeless said that she felt either invisible, day to day, homeless life, and it's nice not to feel invisible. It's nice not to feel like you get out of the way, you don't want to hear. And I also get it, like, it's a long session, but or a workshop. But there could be more exchange of ideas. There's a different type of workshop some other time, that'd be cool too. Much love. I'll just say, we mentioned that she would let me talk to him. With your permission. Yeah. I mean, I was just gonna say, you mentioned sometimes feeling like you don't have the right to maybe seek out services, you don't or feel like you deserve help. I just want to say that all of us here in this room, outside of this room, we believe the same thing. Well, I sort of keep that in your mind. Tuesday's coming today, by the way. And, that's a good thing. Yeah, but I just want to say that I'll pass it over to my colleague here.
Thank you. Can I ask you a couple of questions? First, thank you for coming out and testifying, and it's good to see you. First, I want to say that humanity in us, that we recognize the humanity in you, and that we hear you. So I wanted to say that we see you tonight, and we hear you. First, ask whether you are connected to services.
I'm very well connected.
Okay. There is a strength that you, and you can do this. If you can't do it, connect to services around. Just ask if you would leave contact information. The lady is there, and we're going to make sure that you're able to continue the path that you choose to be the person that you know, and that you have the strength and the support to get from you on your journey. And I think that will be helpful. Okay. So that's a good deal? Sounds like a deal. Okay. Thank you. Thank you. Thanks, man.
Now, again, thank you for the testimony. I'll now ask if anyone else. Going up. You should state your name and address for the record.
I'd just like to say that I was once homeless very recently, and I was housed by the establishment over here. And I definitely appreciate everyone that's here that's listening to me right now and that to all the testimonies. What I'd like to say though is there's resources. There's a lot of different things that can help people uplift themselves. There's a disconnect. That disconnect is not because there's a lack of compassion, because there's few people who are harder. And if you guys are a lot more of you. We have to understand that homelessness and addiction and everything that's plaguing America, the world, is not solely an individual's fault, but everyone's fault as a collective. To overcome that, like everyone said today, we have to do that together. And what I do for myself is propel myself forward so I can help the individuals that I care about. Because they might not believe in themselves, but I believe in them. And another thing I like to say as well is that once an individual is helped, or once an individual realizes more for themselves, they need to understand that they don't have to do it by themselves. And anytime I'm on the same board, you have to teach the independence to these people. For a long time, they want to depend on everyone else to help them. But once they're housed, they have to really focus on themselves and how to be independent. Other people don't really know how to be independent, and I'm learning myself to be more independent in my 30. So it's something that everyone should be thinking about is teaching everyone once they are in a position of taking care of themselves, they can take care of the people. That's all I can say. I'll keep it short. Thank you.
Thank you so much for your testimony and for coming here. Just state your address for the record, please.
Yeah, good evening. My name is Carl Ferris. It is a mere observation. I would like to say, I've been to a meeting last year or early this year. But what I realized that, I'm not saying I want you guys to, there's a lot of people who have something to say. A lot of service providers, here, very part of it, but right now, nobody's here. So if, my thing is like this, if you just swap what's it called, the format, have people who are homeless, the service providers know where they're going to. Because a lot of times, you go to a shelter, a lot of the service, like, exit the difference, get a chance to hear what people got to say. So I think, I mean, I'm saying to direct your, you can have format itself, have people who speak, talk, so now, nobody here. And I understand it's all about you guys also, but one inclusivity. Everybody get a chance to get going on within these lines. So that's what the guys. Another thing also, I'm telling you at. And I was homeless one time, I've been homeless for 10 years. I'm fortunate. I do that right now. And what I realized also, you know, I mean, I hang out with people sometimes a lot, you know what I mean? And you mentioned about the porta potties there. I don't know time around with them and them about it too. You know, every year you got thousands of kids come to Yale. That's we get back up to Yale University. You have this nasty porta potties down there. I literally had to go and stand there for porta potties and bring to City Hall. It's so disgusting. And you have people, millionaires, kids to come to Yale and on the back door of Yale University and nasty porta potties. It's unacceptable. These are things that we go to every day. I mean, the city's doing a lot of things good, don't get me wrong. They're not the city, try to catch it. But another thing also with the shower, so situation. So it's a great idea. A lot of people tell me they don't want to go to the shower, they right on the green right there. I mean, so I mean, these are the things that we're taking into consideration. People don't want to take showers on the green. I mean, so these are things we gotta take into consideration. A lot of people go to that. Bad people homeless, but nobody see you actually homeless. That's that's not good. That's not good to right now.
Thank you so much for coming here. That's good. I don't know, I ask anyone from the public, especially to testify. Maybe not just for the record again, please.
Paula Kidd, Howard Avenue, New Haven. After listening to everyone speaking tonight, it just reminded me of a few things. One, in order to afford affordable or decent affordable housing, one has to be earning at least $37 an hour. Minimum wage, less than 18. That's the problem. We don't have a lot of low income housing. They don't find them because they don't want new houses in the suburbs. Yet you have a lot of suburbians coming to New Haven and working. Yeah. So it's a bit of unbalance. This is not just a city problem, it's a US problem, it's a worldwide problem. And it's also a systemic problem as well. I was thinking about Martin Luther King, and they approved the Fair Housing Act right after he was assassinated. And things are supposed to be moving forward, yet we seem to be moving backwards. Renting a room for something, or monthly anyway, for something that happened back in the 60s. And it seems like we're right back there again, where people can't afford to rent housing, like an apartment, one bedroom, studio. So they have to rent a room. And rooms are going for now what you would probably pay for a one bedroom apartment, which is ridiculous. Housing is such a big issue, yet, you know, it's crazy. You know, it's so big on the agenda, yet where is everybody with their housing issues? You know, where are all the other grassroots organizations? Where is everyone by making this a big deal so that it can happen, like earlier, in numbers? You know, not too long ago, I'm not sure if people understand on it, but there was, well, you can, but you know what I'm saying. But a friend of mine, Liam, running for local election, and his thing is on housing. He's Haven legal, but he's still under control. And his big issue is housing. Did a big campaign, everything, wonderful guy, was on the forum with the mayor, Albertus Magnus, another thing that Christian Community Action and others Justice put together. And yeah, when it came to people coming out to vote, I was celebrating the numbers for one of the newspapers, and you're getting numbers like 18 and 25 and 50 people coming out to vote. Yeah, it's such a big issue. So where is it with all that housing? Like, it only seems to affect some people when it's at the last minute. And we want to hear from those people all the time, not just a little bit. We want to see them, we want to hear them all the time. But not to mention with the shelters and everything, those people are testifying because of the acts and they have to be backed by. I just think that something that is so important that Velma has put on tonight, that we don't have a much larger representation of what is going on in New Haven tonight.
Thank you so much, Mayor, for coming tonight. Sorry, guys. Now I ask if anyone else from the public wishes to testify at this moment. For the second time, is there anyone from the public wishing to testify at this moment? Third time, public wishing to testify at this time. Hearing none. Motion has been moved and seconded. Any discussion? Seeing none, all in favor, say aye. Aye. Any opposed? Any abstentions? Motion to close the public portion of the meeting has been passed. Now I entertain any other motions.
Mr. Chairman, we adjourn.
Second.
Discussion. Seeing none, all in favor, say aye. Aye. Any abstentions? Motion to adjourn has been passed.